We are in the midst now of what is an immunotherapy revolution in multiple myeloma. We saw for the last decade the incorporation of monoclonal antibodies, who are really kind of the low-hanging fruit of immunotherapy. But they have certainly, particularly the CD38 monoclonal antibodies, really transformed the field, greatly improved the outcomes for both newly diagnosed and relapsed refractory patients. But I really think that's only the beginning. I would say 90% of the excitement of upcoming therapies are modalities of immunotherapy, particularly the CAR T cells and the bispecific antibodies. The CAR T cells, evidently, we have the very well-known success of some of the anti-BCMA autologous CAR T cell, including an approval of ide-cel. I think in the future, we're going to see, of course, approval of other BCMA CAR T cell, particularly cilta-cel. But I think there's going to be a flow of improvements in the upcoming years with different modifications or different versions of BCMA CAR T that could lead to more sustained responses and also a better safety profile. There's also a great interest in other targets. We're now approach BCMA in at least 3 mainstream different ways with T-cell engagers, CAR T and antibody drug conjugate. So it's necessary that we're going to eventually have other targets. And of those, the most promising seem to be GPRC5D, as we have seen with the success of Talquetamab, subcutaneous, bispecific T-cell engager that is very safe once you pass those initial step-up doses. That is administered in the outpatient setting and has very little to no CRS beyond grade 2, and that's limited to the first cycle. So I think it's going to be those are agents that have a potential and a scalability to move quickly to earlier lines of therapy. We also seen with great interest the validation of FcRH5 as a target to immunotherapy with the early success of Cevostamab, which is also bispecific, T-cell engager. So I think the potential for combination of those T-cell engagers is pretty obvious. There are studies in progress that's going to combine, T-cell engagers on the same line of therapy that tackle different targets, as well as combined with existing therapies, particularly the immunomodulatory agents, the CD38 monoclonal antibodies, and evidently the proteasome inhibitors.